The counseling center was an outgrowth, originally the Alcohol Rehabilitation Center, which was a residential program that served 10 different counties. They started developing outpatient programs, so the Scioto County Counseling Center was formed, and there was a director who was also a counselor, another counselor, and a secretary. That's all there was to the Scioto County Counseling Center in 1980. The agency stayed fairly small through the 80s. In 1989, I came to the agency, and at that point, I was employee number 7. In 1992, we wrote a significant grant for the creation of a women's residential program. And our goal was to be able to create opportunities for people that were having difficulty accessing services. And the number one population to access service was women with children. Tremendous stigma that was associated with women who were seeking treatment. So we started Stepping Stone House. We started it by allowing women who had children under the age of 12 to bring their children into treatment with them. And that was, at the time, very innovative. There was only a couple of other agencies within the state that allowed children at all. Over the years, we were very proud of Stepping Stone House and the number of women that were able to give birth to drug-free babies. Stepping Stone House worked out very well, so in 1994 we opened up the Marsh House, which was a residential, 16-bed residential program for men. Within the men population, we were getting a lot of referrals from the legal system, courts, people on probation, alternatives to jail, and the Marsh House took off very quickly, and to the point to where we had trouble even having enough beds for the men that were seeking services. So over the next several years, up to the point where the counseling center now, it's been a matter of trying to keep up with the demand for treatment. And the philosophy of the counseling center has always been to try and create a bridge to access, so that if people need treatment, that they can get that treatment as quickly as possible. The counseling center made a decision very early on that, if we were going to create a service, then we had to learn from the services that we were providing and see what else needed to be provided in terms of enhancements. And the very first thing we heard from both men and women that were graduating from Stepping Stone House or the Marsh House is that a significant number of them had no place to go once they completed treatment. So that led to the development of what we call now the transitional living program or the sober living programs. And those programs proved so successful that they have just continued to grow. The agency now has, a significant number of beds, over 300 beds that they're providing. The counseling center has developed a reputation around the state of Ohio being able to provide a continuum of care that is complete. And now we're treating so many new patients that access to primary health care was getting much more difficult. So we decided that the answer to that was to start providing our own health care, and that was how the creation of Compass Community Health came into existence. We started off with one medical provider, a nursing staff, and of course then Compass has grown significantly to the point of becoming a federally qualified healthcare center. And of course, Scioto County was the epicenter of the opiate epidemic that struck in the early 2000s, and that drove many more people to the criminal justice system. And so the counseling center has become an integral part of all the social services and all of the criminal justice systems within almost the whole state of Ohio, in terms of being an alternative treatment facility and a place of care that people can trust.
As we've built our continuum of care, it's not just do a service for 30, 60 days and then kind of back out in the community.
We have continued to develop this very comprehensive continuum of care that can take somebody from a crisis or withdrawal management right on through to sober living.
Affordable housing, transportation, they might need help getting a GED.
vocational training to a job.
Childcare, health and wellness programs to feel better and to get in better shape. So, we've embraced that.
So many of the folks that we provide treatment to have a lot of skills, but those have not been tapped into. A lot of those folks, their problems began when they were very young. And so the counseling center, as it sees its mission in the future, has been to not only lift up someone out of their addiction, but also to provide these new opportunities for becoming a citizen within our community, to be able to be self-sufficient, to be able to take care of providing their own housing and their own health care, and to be able to take care of their families, and to be able to be responsible for those things that perhaps they've never had an opportunity to because of their addiction.
We employ 420 people, so this is about our clients. It's about helping them get clean and sober, but it's also an economic development project for Southern Ohio.
A significant number of employees of the counseling center are people who have received services from the counseling center. And I think that definitely sets us apart because those folks are able to continually kind of hold our feet to the fire in terms of what our true philosophy is, and to remind us if we're ever getting off track.
We got the spotlight even in the national media. You might have seen us on the Today Show. We were featured in the Boston Globe, the New York Times.
One of the things that I'm probably most proud of in terms of the counseling center is that the potential for recovery has been realized by so many people. We have people able to essentially celebrate their recovery with their families, within our community, to talk about how these services have made a difference in their lives.
We're very proud of the model that we've developed here at the Counseling Center.